Despite recent efforts from the federal government to address the ongoing baby formula shortage, parents are still struggling to feed their infants. The nationwide shortage is also highlighting the racial disparity among mothers of color feeding their children. According to the CDC, 20% of Black women and 23% of Hispanic women breastfeed their children through 6 months, compared to 29% of white women. To help us break this down, I want to bring in Andrea Freeman. She's a professor of law at the University of Hawaii at Manoa and author of Skimmed, Breastfeeding, Race and Justice. Andrea, welcome. So why are we seeing such racial disparities among mothers of color trying to breastfeed, trying to find baby formula?
Well, Black mothers have always had the lowest rates of breastfeeding since enslavement. That's something that we've had in this country since it began. And they have always had to work, and their workplaces often do not accommodate breastfeeding or pumping. So we have a lot of structural factors that make it harder. Black women also tend to live in neighborhoods without a lot of support. They can be in hospitals that assume that they're going to use formula, and they're just not receiving the same kind of assistance that white moms get.
All right, and Andrea, in your book, Skimmed, Breastfeeding, Race and Justice, you highlight marketing efforts for baby formula toward Black mothers and the disparity in that. So can you walk us through your research and how it relates to the crisis that we're seeing today?
Absolutely. So in the book, I talk about the first Black formula models, the famous Fultz quadruplets that were born in North Carolina in 1946, whose white doctor decided that he was going to put them up in a bidding war to formula companies to become their corporate godfather. And these quadruplets became the first Black models for formula and the first to be selling any kind of product that was not just alcohol, cigarettes, or beauty products aimed at Black families. Against the backdrop of this kind of race-targeted marketing is the fact that when we see images of breastfeeding moms, they are usually white in pop culture and in media. And that reinforces the stereotypes that invade, doctors' perceptions, nurses' perceptions, and society's perceptions. But the marketing that is even more important is what happens in hospitals, where formula is given out free, in pediatricians' offices, and through the WIC program, where the federal government purchases more than half of all of the formula that's bought in the United States and gives it out for free for 6 months to women who participate in the program. And it covers more than half of the women in the United States, disproportionately women of color, and women who participate in that program use formula at much higher rates than women who don't.
And Andrea, in the States, where are we seeing the formula shortages the most, and then how does that impact mothers of color?
We are seeing greater shortages in the South, which are often the first food deserts, where people do not have a lot of resources, where there's a concentration of Black communities, and where there isn't enough money put into the help, and people are just kind of on their own now.
Andrea, thank you.